Good morning, Dr. Miller. It's nice to have you with us. We met at the seminary at Andrews University a couple of years ago. I took at least one class from you. You're a professor of church history. You are responsible for the Religious Liberty Department of the Lake Union Conference. And before you went into theology and church history, you were a lawyer and have practiced law as well. So those are some of the qualifications that makes me want to talk to you right now.
Good. Well, I'm glad to be able to join you, and I trust you're settling back into your home country. It was nice to have you and your family for a few years here at the seminary, and I hope I didn't impair you too badly in the class that you took from me.
It was a pleasure, and yes, we have sort of settled in. My kids are finally speaking Danish again.
Very good.
We're going to talk a little bit about this from a church history perspective, what's going on in the world right now, and also some of the legal aspects. People are asking questions. What are we supposed to think with all of the restrictions that are happening? And I thought one place to begin with this is simply, what has the experience been like for you in Michigan these last few weeks? What are the restrictions that have been imposed there?
Well, I think it's been much like the rest of the United States, if not the world. We've been basically on a lockdown with only essential trips allowed outside the home. It's not perhaps as severe as it sounds. You don't really have to stay in your house 24 hours a day. The order allows for recreational trips outside. As long as you keep social distancing going, you can go biking or hiking or running. Any outdoor activity that you can keep 6 to 10 feet away from others. A friend of mine next door and I go for daily disc golf walks through the parks and the lands of Andrews University here. There is a bit of controversy here in Michigan, actually, because just last week the governor extended the lockdown until at least the end of April, and she also added some provisions. Many of the businesses were closed. Essential ones stay open. But places like Walmart and Lowe's, big box stores, have essential parts to them, but then people were going and buying things in what were considered unessential sections. So she put a provision in sort of locking down the home and garden areas and paint supplies. And a lot of people think that this has been unnecessary and she's going too far. And in fact, there was a rather lively protest in Lansing, the capital of Michigan, yesterday, where some conservative groups got thousands of people together to go driving through the Capitol honking their horns. And so the governor's a Democrat, a left-wing politician, and Michigan has a fair number of strong conservatives here. And so there's a brewing confrontation between those who think that she's overstepped her bounds and made the lockdown too restrictive.
And I mean, a lot of this sounds similar to Denmark, except that obviously one of the differences is we do not have the same amount of police. We do not have the same abilities to actually enforce restrictions. We're much more reliant on people following the government's recommendations, and we have more of that in our history. But what are these concerns coming out of? You mentioned it's the more conservative groups. I'm assuming that also means that a lot of them are religious. How does the fact that churches have also been shut down?
Well, this is a very interesting point, and I don't know why that this has happened, given that the governor is Democrat and liberal. She actually has placed in her orders the clause that these laws will not be enforced as to groups meeting for worship services. So technically in Michigan, there is a fairly generous exemption for, at least for meeting for worship purposes, unlike some other states that have restricted also worship services. Now, the irony perhaps is that most church organizations here in Michigan, certainly the Seventh-day Adventist Church, have chosen to voluntarily follow the guidelines and the federal guidelines and also the state laws. And all of our churches are not meeting in person. We're live streaming services. So whatever the protests are, they don't have to do with religion, because the governor specifically exempted religion, though in many states that's not the case. And there are Christian groups. In fact, in California, just in the last couple of days, several churches sued the governor there, Governor Newsom, because of his restriction on church services and meetings. And so these issues of quarantine and public health versus religious liberty and the right to assemble are going to clash in court. And we'll probably get some rulings in the next few days and weeks.
Okay, it'll be interesting to see how that has ramifications for things in the rest of the country. I have a cousin out in California where a couple of weeks ago they got permission from the local sheriff to live stream their worship and to do that, but that's probably also ceased at this point. You mentioned that all of the churches, the Seventh-day Adventist churches in Michigan, that you have voluntarily chosen to shut down anyway. Why have you done that? Do you have church members that are complaining or concerned about this?
Well, you know, there's always a few voices on Facebook that suggest we're capitulating too easily to the government's limitations, but I think we just genuinely recognize it as a health crisis, and that we're staying home for the benefit of our older members. You know, the Adventist Church here in Michigan has a strong elderly population. You know, the average church member age is probably in the early 60s. So we have many people that could be jeopardized by these if we chose to gather. And, you know, taking a page from history, being a historian, you're familiar with the 1918 Spanish flu pandemic. And of course, our church existed at that time. So I was very interested to see if there had been similar kinds of shutdowns then, and if so, how had our church reacted to that? Because we've always had this very sensitive outlook to religious liberty issues. Right. And certainly our pioneers and early church leaders spoke much about, you know, the dangers of the government intruding into church worship. And so I went back and read some of the Adventist reviews as well as the Lake Union Heralds from 1918 and 1919. And I discovered that indeed there had been shutdowns. There were periods of time for 2 months where schools did not meet, churches did not meet, evangelistic campaigns didn't happen, camp meetings didn't happen, just complete shutdown. And remember, this was at a time when there wasn't the internet and live streaming and Zoom Sabbath School and all of that we can continue with today. And all I could find was matter-of-fact reporting that these things happened, that Adventists did not meet, that they focused on medical missionary work from their homes. And I hope we can talk a little bit about our natural remedies and the hydrotherapy they did, which was actually very effective. But nary a peep could I find about religious liberty issues or the Constitution or the deprivation of civil liberties. I think that Adventists, we were on the cutting edge of health issues and health reform. And it seems that most people accepted this as a genuine need for public health, both of the church and of the community. And really, it seems that today we're more vocal about these things because we've lost a sense, I think, of the balance between health and other rights, and that religious freedom isn't an absolute right? It's something that's weighed and balanced in with the other rights that people have.
So, I mean, that's interesting that this is not, I mean, obviously it's the first time in our lifetime, but it's not the first time this has happened in the history of our church. Why do you think I mean, 1918 is only 3 years after Ellen White dies. Obviously, a lot of the church leaders at that time still had a connection to things that she had written and counsel that she had given. What has changed over the last 100 years? Or is it mainly these few voices on Facebook that I don't want to give a megaphone to? But what is it that has changed? Why are we reacting differently this time?
Well, I think after Ellen White died in the 1920s and 1930s, Adventism very much had an encounter and was influenced by what I call fundamentalism, by a very conservative branch of evangelical Christianity that had a more absolutist approach to, well, a number of things, but certainly including church and state. They had an absolutist approach to the separation of church and state in ways that our pioneers didn't. Our pioneers were involved in public policy matters, opposing slavery, seeking laws to outlaw the sale and use of alcohol. Even though we believe that the church and state spiritually should be kept separate, we thought that church members should have a moral engagement with their society. But fundamentalists tended to want to completely separate it. The church should be quietist, pietist. And part of this was also then a belief in the kind of absolutist view of religious freedom, that my right to religious freedom is absolute and shouldn't be weighed or balanced in any way by the government with other concerns in society. And while it's tempting for us as Christian believers to view our religious rights as absolute, the problem is, if you, a quick thought test the limits of that is, well, what if there was a sect or a cult that believed in human sacrifice, right? Would we allow that? Would we accept that? Well, no, that would be going too far. So what if it was a cult or a sect that believed not in human sacrifice, but in, well, you know, passing around a disease that could be quite deadly under some circumstances and threaten the community? Shouldn't there be limits on that? And the answer, if you think about it, would appear to be yes. So Adventists have always accepted that there needs to be that my right to practice my religion, like all other rights, trails off and diminishes as I begin impacting and affecting other people in the community. And that's what's at stake here.
So would you say then that part of our struggle as Seventh-day Adventists in thinking of religious liberty, where we might tend to think of it as an absolute right, is because we have simply narrowed our understanding of religious liberty to our own faith, not thinking of everybody else?
Yeah, I think that's a one way of framing it, certainly. And American Christianity, evangelical Christianity, is sort of falling into that ditch. They view religious freedom as often the freedom of Christians to participate and influence the government and public affairs. But if you speak to them about Muslims or other groups, well, they're not so convinced that there needs to be freedom for untrue religions in the way that there can be for the one true religion.
Okay. You mentioned before that you hoped we could talk a little bit more about treatments, and I'm guessing that you're also thinking of, well, the medical missionary work that they did practice at the time. How does that relate to what we could be offering right now? What do you see as our role as Seventh-day Adventist Christians in what is going on right now?
Well, we've always taught that the health work is the right arm of the message, and that it plays a powerful and important role in reaching our communities. And most members have tended to view that as a special part of the work that our nurses and doctors are carrying out. We have various hospital systems and clinics, but there was a very interesting editorial in the 1918 Adventist Review in October, and I believe we'll be putting a link on your page to an article I wrote that also contains references to this other article. And we were told by the medical director of the General Conference at the time, Dr. Rubel, that our church members should become medical missionaries, all, not just our nurses and doctors, but that there should be health programs at our churches to teach people how to give simple in-home remedies for dealing with these problems. And this just wasn't talk. There was actually some rather remarkable outcomes to the Spanish flu. It was quite a lethal flu, certainly as lethal, if not more than the one in the present pandemic. There was a second wave of it that was particularly fatal that peaked in about October 1918. And death rates were as high as 10 to 15% in various parts of the country and the world. There was a seminary, and actually Scandinavian seminary, that I was not aware of in Charleston, Minnesota. And it had started as a Swedish seminary, I believe, and it was actually a Swedish-speaking seminary. It shifted, and by the time the 1918 pandemic came along, I believe it was English-speaking. But there were 180 students at it, and there were 120 that lived on the campus, and 90 of them came down with symptoms of influenza. There was a physician on staff who knew about Adventist natural remedies, hydrotherapy, and they followed a course of action with each of the students as they came down with the illness, and they were tended by nurses and some of the other students. They would isolate them, put them to bed, give them a balanced, healthy diet to boost their immune system. And then they carried out hydrotherapy, which consisted of poultices, fomentations, hot towels put on the chest and throat and also on the back for about 15 or 20 minutes at a time, and then a cold covering afterwards. And they repeat this 3 or 4 times a day. And they did that with all the patients as soon as the first symptoms were noticed. And they had no fatalities out of the 90 students. And in fact, none of the students progressed to the pneumonia stage of the disease. And the public health official of Charleston at the time commented that the handling of this at the Charleston Seminary, it had the best record of any institution in the state of Minnesota in dealing with this. Since I first researched this story, I discovered that similar testimonies exist for Southern Adventist University and Oakwood and some other places as well, where these treatments were. It's not that once the disease progressed to the level of pneumonia, these weren't fail-proof methods for bringing people back, right? These were things you could do at the more mild to moderate levels of the progression. Yeah. And so I don't want to communicate that everybody at every stage of this hydrotherapy is the end all and be all. It's something that took place at the earlier stages and prevented the progression. And if people have progressed pneumonia, this is not meant to be a substitute for conventional medical care. It's meant to be a supplement and an earlier intervention to prevent the progression. If you've had the progression, then you need to go in and see a doctor and maybe be in an ICU.
Well, but it's remarkable when you think about that these are some of the things that turn up when you started doing your research about what was going on. And when we think of some of the stories coming out today where it's like, okay, well, in France or in South Korea, we have Christian groups that somehow become at the center of attention because maybe they met together when they weren't supposed to, and they helped spread it.
Where they're spreading it, right?
Yeah. And when you look back at history here, it's like, no, what we were known for back then was actually helping to relieve and to minimize casualties, fatalities. That would be a lot nicer to be known for than spreading the actual disease.
Correct. And for those of your listeners who are interested in this, again, my article contains some footnotes to some sources and resources. And actually, there's a companion article, the link that I'll provide, that same issue of the Lake Union Herald. There's a Dr. John Kelly who's written a companion piece of about a page and a half where he goes over some of these treatments and then has some links to some YouTube videos where people can watch and be instructed on how to actually carry this out. And this is something that can be done in the home with microwaves and towels. And so if people are wanting to supplement the healthcare system, they can actually learn to do this and do it effectively.
We'll be sure to link to this in the comment section, both on YouTube and Facebook. One of the things that I want to try and maybe return to a little bit is this. We started out talking a little bit about the legal aspects, because obviously, as Seventh-day Adventists, we have an understanding of prophecy, where we see an end time scenario where restrictions are imposed, where it does become hard to be church as we know it today. How do we say to even our own children, no, we can't go to church, we still can't go to church, and isn't this part of what we can expect, that suddenly these rights will be taken away?
So it's very hard for Adventists, right? Because our eschatology is about the government intervening in our worship and preventing us from going to church. And lo and behold, what's happening? You know, in most places, many places, the government is doing exactly that. The trouble is there's two special parts of Revelation 13 that just aren't being fulfilled in this current event. And one of them is, it's not just about not being able to go to church, it's that certain minority religious groups are discriminated against and aren't able to worship as they are convicted, right? It's that there's a majority religious view and then these minorities that are being prevented. And that's just not the case here. It's all gatherings, not even just all religious gatherings. It's concerts, it's sporting events, it's everything. So there's not a discrimination against religion. And the second point about Revelation 13 is that there's a coercion of worship, right? It's talking about you must worship or you'll receive this mark of the beast. And at this point, nobody is engaged in coercive worship or saying you must worship in a certain kind of way. So I have a student, I think you remember who David Hamstra was and still is. He is a PhD student at the seminary. I'm working with him on his projects. He's now back, he finished his classwork and he's a pastor in Canada now, but I want to give him credit whenever I use this phrase because he helped me put together a little, it's not quite, it's kind of like a scriptural acronym. He came up with the couplet that what's happening now isn't Revelation 13, it's Leviticus 13. And Leviticus 13 has to do with the quarantine laws of Israel. And then I added to that, so let's act like 1 Corinthians 13, of course, which is the great chapter on love and the way we should treat our neighbors and each other, until Romans 13 is complete. And Romans 13 is the passage in the New Testament that talks about the legitimate role of government in punishing evil and in rewarding good. And so these four texts, all with a chapter 13, remind us that Revelation 13 is not necessarily filled by doing what's in Leviticus 13. The Bible itself recognizes the legitimacy of a quarantine period, even for people who aren't known to be fully sick. If you read Leviticus 13, it's people who are suspected, and they're quarantined for 7 days, which would prevent them from going to church. And this system was actually endorsed by Christ, wasn't it? Because when he heals the lepers, what does he do? He sends them to be declared clean by the priest. So the quarantine system was still in place. And as Christians, too many people are talking about my rights to worship, whereas if we really thought about 1 Corinthians 13, we might think about other people's rights to be free from death and dying from the disease that our worship could bring to them. So why don't we just take a breather and think about Romans 13 and the role that government legitimately does play. And insofar as there really is a threat to health and life, it seems to me that these quarantine restrictions, as long as they're passed neutrally and they apply to everyone, they're not focused on one particular religious group, really that doesn't rise to the level of the Revelation 13 that we've talked about. But all of this doesn't mean that we shouldn't be cautious and careful and on the lookout for the usurpation of power and authority, which always happens at times of crisis, right? We're as citizens, we're going to have to be on our guard, because you give the government an inch and they'll take a mile. And so, yes, we need to be careful. But if we start yelling too quickly and too soon, and we cry wolf when there really is a legitimate concern, then we're going to undermine our ability to speak frankly and candidly about this in the future.
And of course, and thank you. Thank you for that perspective, because obviously in a country like Denmark, where there is probably, and I don't think I'm overstating this, a greater level of trust in government, generally speaking, than there is for the average American. And so what's interesting right now is obviously to see, because of the internet, because news travels everywhere, we start to have some of the same reactions, even though we don't have that tradition. If I can follow up just on what you said about, if we were to think of other people's health and preventing other people from dying rather than thinking about my rights. You mentioned Revelation 13 and that only part of this applies. Would it be fair to say as well that we tend to, in Europe, in the United States, also to become more concerned when calamities hit our part of the world?
Well, that we tend to become more concerned with our own liberties, or I'm not sure I quite understand the question.
Well, that we tend to become more concerned and we think, well, now Jesus is coming because people in Europe and the United States are suffering.
Oh, well, yes, there is a bit of Westo-centric thinking in all of this. In some ways, we are experiencing in the West what many people in Asia or Africa have experienced on a more regular basis in the past. I remember one commentator from Africa talking about the coronavirus coming in, and he was sort of joking, but he was saying, Africa, so many bad things here happen so often that Africa really doesn't have much time to pay attention to you. And my parents lived in Africa for about 11 years, and they were worked in the Ivory Coast, and I had a chance to visit them there. And it's just a fact of life that you live with death more commonly and more frequently, and it's sad in a sense. And yet we in the West don't understand that. And now perhaps we understand a little bit more the more precarious nature of civilization outside our privileged boundaries. And the coronavirus in some ways has been a great leveler on one hand, although on the other hand, it has, it's sad, it has impacted minority communities. For instance, here in America, it's really revealed the inequities in our medical system in rather dramatic ways. And so the privileged still are protected to some degree. But in other ways, we're just praying for the life of our medical director here in Berrien Springs, one of the doctors who's worked in the community for decades and is now the medical officer of the Lakeland healthcare system, is on a ventilator, and these 24 hours could decide his fate. And so a number of us are praying and fasting, and he's a man of privilege, of training, of background and experience, but that doesn't stop him from facing the ultimate questions in an ICU here in the next few hours. So it's
we've seen that in Europe, obviously this last week, where the Prime Minister of the UK has come out, and he released a video explaining how for 48 hours it could have gone either way, and he is so thankful for the nurses, for the medical professionals that are working round the clock right now to help people.
Yep.
And I just hope that when we come out on the other side of this, that people will remember us as well as people that were helping and giving hope rather than spreading more fear, because people are scared enough without
That's
us
right.
adding to it.
Well, I think we have a great message, and we have a message that can help with this inequity, because the kinds of natural and home remedies that are able to stop people from maybe getting worse are available inexpensively, and they can be done by poor and rich alike. And so I think that we have a great opportunity for education, especially perhaps in our poorer communities and our less advantaged population groups.
Before we finish, thank you so much for your time. The last thing that I've written down that I wanted to make sure to ask you is really, what would you say right now? Any words of hope for people that are struggling? What should we be doing right now, more than just, and I don't mean just praying, but I hope that's not misunderstood, but obviously we need to pray for people, and we should remember the physician that you just mentioned as well. What else should we do to give people hope? What would you say?
Well, it's a great question, and I think that you bring hope to yourself as you seek to bring help and hope to others. And I think in many places we're rediscovering the communities that we live in. I recently moved into a new neighborhood and don't know terribly well the people around me, but I've made a point. I have senior citizens living on either side of me. And so it's given me an opportunity every few days. I go in and check and see if everyone's okay, and offer to do a grocery run, or, we're encouraging our seniors to stay inside, and it's given me an opportunity to pray with them. That's just my situation. I know that everybody has somebody near them that they can provide some support and help and comfort to, whether it be over the phone or over Skype. The ministry of Jesus was to meet the needs of the people as he saw them and those immediately around them. And certainly this has given us that opportunity. And I pray that we as Adventists will take every advantage of it to be positive, to share things on the internet that are hopeful and uplifting. Obviously, sometimes you have to share news that's not. I just looking at a story that I shared about a Virginia pastor who decided that he was protected by God and he was going to defy the authorities, and he called a church service, and they had a meeting. And unfortunately, just a few days ago, he died from the coronavirus, and now his family is infected as well. I'm comforted to know that God sometimes accepts our overzealous service, that he will be judged by a gracious and kind and merciful Heavenly Father. But it's also an illustration to us of the line between faith and presumption. And when God gives us science and the ability to understand these maladies, that we need to act in a way to help us and to help our neighbors in a spirit of love. And let's be known for that, and not as the people who oppose the authorities and at the risk of their own lives and that of our neighbors. Let's stand for conscience when that's important, but let's not be presumptuous in doing so.
Thank you so much. You said it well when you said that when we help others and we give them hope, that also gives us hope. And I pray that that the conversation we have had here as well will inspire people to be able to help and to spread hope in what's going on. Thank you very much for your time.
Sure, Thomas. Always good to be with you. Blessings.